All right, well, hi. Thanks, everyone, for joining the webinar today. This is Mark Graban. Thanks for checking in. I've always liked to keep in touch with people who've come to my workshops and try to give people advice over time. Feel free. You've got my contact information, and it'll be here at the end of the slides again. Feel free anytime if you want to reach out, email me a question, if you want to schedule a phone call. I always like to try to be able to follow up and help out, even if it's very informal. And some of you have kind of shared some information about what you're doing since attending the workshop, and we've got some Q&A and some other topics that I think might be helpful, kind of going beyond what we covered in our original half-day workshop. Just real quickly, and just to mention briefly, this book might not have been out when we did our workshop together, depending on what time it was in 2013. So Joe Schwartz and I have a new book. It's called The Executive Guide to Healthcare Kaizen. Came out in August. It's a companion book to the full Healthcare Kaizen book that you all received in the workshop. So you might know, and we got feedback about this, the book is heavy. There's a lot of great stuff there. It's almost 5 pounds because of the paper for the color pictures. And so we honestly got some feedback who said, the stuff in here is great, but we need our executives to read it. This is too heavy for them to take on a plane. And so Joe and I did the executive guide version. It's shorter, it's smaller. It doesn't have all of the how-to detail. It doesn't have all of the great examples. But hopefully it's enough to help get the ball rolling in your organization. And if this is something you're interested in, you can contact me. I can work with you to get a special author discount price on this, or you can find it on Amazon and different ways. So I hope this book is helpful to you in addition to what we covered in the workshop and in the bigger, fuller, more complete book. So people who answered the survey, who said that I could share their experiences with them, had some different thoughts to share. So one of those organizations is a healthcare organization. They have one Kaizen board that's up and running. And they've been making good use of that. What they reported in terms of being a positive comment, they said, for the most part, staff are excited and like the concept, however, see it as another to-do. So this is, I think, a very common thing, and it's true. I mean, it's one additional thing to be doing on top of our daily tasks as staff members. It's one more thing for supervisors and managers to do. But I think there's really great opportunities, and I'll talk about this again in a bit. There's great opportunities to initially do a little bit more work toward Kaizen. But that Kaizen work, when it's focused on freeing up time, becomes a net time saver. And so we have to sometimes as leaders give people, help them find the courage to give it a try. We have to be encouraging. We have to convince people just to give it a shot. And we'll talk more about some strategies for making time for Kaizen and how important that is, as we talked about originally in the workshop. The other comment they made was that they said one physician said it was, quote, silly. Some people, unfortunately, they're for whatever reasons, because of organizational history or whatever their background might be, they haven't been. It hasn't been reinforced to them that everybody should have a voice, that everybody's input is valuable. And so sometimes we have to demonstrate to people that our employees do have great ideas, regardless of where they are in the organization. So if somebody thinks this is silly, I would encourage you to kind of keep plowing forward and help build enthusiasm over time by demonstrating that this can be helpful. If a physician thinks Kaizen is silly, ask people to try to come up with ideas that can help make the workplace a better environment for that physician. We see this more broadly with Lean, and we see it with Kaizen. If you can emphasize that this isn't just another thing to do, but this is about making your work easier, about making patient care better, that can get people on board. But as the physician said, it allowed everyone to speak, which is different than previous team meetings that we had before. But again, Kaizen is not just about everybody speaking or everybody having a voice. That's important. But Kaizen is also about everyone being able to take action so that this doesn't all fall on the shoulders of a single manager. And organizations, as I've helped them get started with Kaizen, actually, in practice, outside of a classroom, in their departments, that's one of the very first challenges that they have to address. So I want to tell a story kind of along those lines from a client that I worked with last year. The emergency department director, he was generally an enthusiastic guy. I didn't sense that he had been completely dragged into Kaizen. The executive leadership had selected the emergency department because this guy was kind of gung-ho in general about improvement. But he was a little bit skeptical. It's his new approach. Wasn't really used to being out in the units, or as we'd say in the lean world, out in the gemba. I was trying to be patient with him because I realized that he was building new habits, and this was maybe going to be uncomfortable for him at first. So I worked with him and coached him, tried to help him understand that this was going to be okay, that he could do this. I spent a few hours a day with him out in the unit, working with staff on Kaizen, trying to identify problems, to help see waste, to ask people what struggles they were coming across, what ideas that they had. And by the end of the first day, I was really surprised. He came back the second day. And the feedback that I heard secondhand, and then I went and talked to him about it directly, was that he was running around telling other directors how great this Kaizen idea, this Kaizen process was. Even right away, he became the biggest advocate for how doing Kaizen, he saw very quickly the potential that this is going to be a net time saver for him. And the way he articulated, he said, pretty directly, with this process, I'm no longer going to get the same complaint 10 times a day in the hallway every day. There's going to be a process. Instead of people just complaining, there's a process, and that's Kaizen, for people to bring ideas forward, for them to be acknowledged, for them to be captured and documented, and other people can see, if someone else has brought that up as an issue, they're going to work to fix it, or maybe we can work together to fix that issue, to solve that problem. And so sure, getting things resolved requires an investment, but very quickly starts saving time. And sometimes people, even if they're not convinced that they're going to do this well, just by diving in and giving it a shot, they realize that, that's really not that hard. It's really not that intimidating. So my advice sometimes is, how do you get started? Just start. Don't be too hung up on being perfect. So some other feedback from that site one that was in the workshop. They said their challenges included sustainment and using Kaizen in a clinical environment. They volunteered that they don't have any electronic methods available, but they believe that the visual approach is the most valuable in a clinical area. And there's certainly a lot to be said for that. That's why I teach on this very visible and visual idea board approach, or Kaizen boards. So, I think some of my tips related to having it be visual, and I'll share a couple examples here, is, to keep it fun. That Kaizen, even back to Toyota, it's described that there's a spirit of fun and joy and enthusiasm that's part of a Kaizen culture. I think we talked about this in the workshop. Let staff decorate the board. Let them take ownership of them. Let them make it colorful. Give it a theme. As an engineer, I tend to do, vertical lines and boring, and I'm focused on the function of the board. But I think it is really important to catch people's attention, to let it be a little bit fun. We discuss sometimes about whether, is decorating the board a non-value-added activity? Well, sure, it probably is. The patients don't want to pay us, or customers don't want to pay us for having a decorated board. I understand that. But if decorating the board helps facilitate the Kaizen process, if it leads to higher engagement, if it leads to greater participation, if it leads to people stopping and actually reading the board, then I would argue that that's, even if it's not value added, it's helpful, and we might want to do this. One thing I see other organizations doing is mixing it up and changing the theme regularly, monthly, quarterly, keeping the board fresh and helping people keep looking at it. Helps prevent the board from becoming wallpaper, that's really stale and that nobody even sees anymore. Now, if it's a really active Kaizen board with lots of new ideas and lots of progress and lots of engagement, people will keep looking at that board. But I think we can help attract and sustain the attention of those who aren't initially as interested by just cosmetically changing the board and keeping it fresh. So here's an example. I was with some folks in October. They one of their staff members had a bunch of scrapbooking stuff at home, and she really kind of took it upon herself to make it, as you see here, sort of a October-November themed board for Halloween and for Thanksgiving. People stop by and say, well, look at this. This is different than the usual dry, boring bulletin board that would just normally have sheets of paper on it. So I like what they did there. There's another organization I worked with about 1.5 years ago that got really fun. I think they did this during Oscar Awards season. Now, they changed the terminology from new ideas to doing, and done. It's about, script pitches, casting, shooting, the print dailies. So, you might have to explain to people what this terminology is about. And then when ideas are completed, they said they were released. So I love this, though, because for one, we'd say it's a very active board with a lot of activity. Nothing is hanging out in the pitches column. It's all moving along through the process. That's a really good sign and a really good thing to see. So I want to step back and tell another story with that ED director that I worked with late last year. So, I was shadowing him, I was coaching him, I was trying to kind of demonstrate Kaizen leadership behaviors and helping him start with Kaizen and to do Kaizen better. And, there were some lessons learned very quickly. And so he was out in the unit, he was trying to engage staff, trying to catch people as they had time, trying to help look for problems, trying to do so in a friendly, engaging way. And, he wasn't feared, he wasn't being mean or nasty or intimidating, even though he was a tall, big guy. But he would go up to people and ask, with a smile. I think his body language was pretty friendly and engaging. And he would stop and he would ask people, are you busy? So now think of a typical emergency department or any hospital department. Either people are very busy, or a lot of times there's fear that nobody wants to admit they're not busy. Because instead of allowing them to work on Kaizen, more often than not what happens is they get sent home, or they get sent someplace else. And so the most likely answer to that question, it was happening 9 times out of 10, was, well, yes. Are you busy? Yes. And people would not even break stride and keep going. Like, nobody wants to be caught not being busy. And so the director was kind of saying, well, gosh, I don't think it was close to giving up, but he said, I don't know, people don't want to do this. I don't know if we can find the time. I said, well, we can't just ask for engagement, but sometimes how we ask makes a difference. And so I asked him to think about what was happening and kind of reflect on this a little bit. Did he really think people didn't want to improve their department? And he said, well, no, I think they do. And so, well, should we give up on this Kaizen business because everyone says they're too busy? And he said, well, no, this is important. We need to keep trying. And so I asked him to think about, well, is there a different way of asking that question that might be more likely to get a yes response? And he thought about it. And so his new approach, and we went and tried it. So in the kind of the PDSA mindset, we're studying, we're adjusting, we're going to go back and try and test something else. He would ask people in the same tone and in the same way, and they were just as busy, hi, can you take a few minutes to talk about improvement ideas? So he's basically asking people now, can you make a little time? And some people said, well, no, I'm on my way, I'm delivering a medication to that room. And he said, okay, well, cool, that's fine. And they said, well, let's talk about it later. But many more people said, yes, let's talk about this. Probably at least 5 out of 10. So I think this is a good adjustment. This is a good way of demonstrating the PDSA, plan, do, study, adjust cycle that's so core to Kaizen. He was able to then talk to people and say, hey, we've got this new Kaizen board, and Kaizen means continuous improvement, and here's how it's going to work. When you have an idea, write it down on a card. You can come to me. We're going to work together on making things happen. So I think that was a really, really nice adjustment that he made. And that's the type of lesson that he can share now with other leaders as they're spreading Kaizen on their own with internal coaches and internal resources, and kind of not make everyone kind of discover or suffer through that same thing again. Kind of coach them. Here's a really good way of asking for Kaizen. So a second organization shared some of their experiences. Let's just call this site number 2. They said they had multiple boards set up in different areas. They said some of the positives included the fact that communicating knowledge work through visual work maps, including the board and the way they're doing process maps, has stimulated crucial conversations and increased the common understanding and definitions of what's being worked on. So it's building collaboration. When cards go up on the board, people can talk about the problems that are up there. I think sometimes the physical act of writing down the problem kind of makes it okay to talk about it. Instead of hiding and covering things up, we can actually engage, which kind of leads to a second kind of just thought that I didn't really plan to talk about, but in that question of writing it down and capturing it. A really, really good practice, I think, is for managers and directors to have these idea cards or Kaizen cards, in their pocket with them the whole time. And if someone comes up to you in the hallway and just complains or brings up a problem, it's a really good practice to say, okay, you know what? Let's write that down. Let's stop right now. Let's write it down. We don't have to solve it right now. We don't need to go through the whole process. But if we don't write it down, it tends to kind of just poof, disappear. So it's a really good habit, a really good discipline to at least just write it down, even just a few words. Put it up on the board, and there's a reminder there to come back and follow up on it as time allows. But Site 2 said, people feel more focused. The staff are being creative and making something that works for them. The formatting, the colors, the way you name the columns. There are lots of different ways of tweaking a Kaizen system to make it your own. A little bit more from Site 2, some of their challenges. These are fairly common things. They said, there's a lack of leadership buy-in and a lack of follow-through for the idea boards. They said there's a lack of a clearly stated mission and values impacts the ability to prioritize work. So when we have things on the idea board, how do we choose what to work on next? Really key question. We need to have some way of helping drive that in a way that's aligned with the organization, not just what we feel that we should work on. Another challenge was agreeing when something moves from doing to done and defining and scoping a finished task or deliverable. So I'll talk a little bit more about some ways we might think about moving cards on the board and coming up with some kind of shared definitions of those different columns as an organization. And then, so it's also a challenge managing Kaizen boards for projects, teams, and groups, which I don't know if that means more distributed teams. One challenge or one downside of a physical bulletin board is that it's not as helpful if we have a distributed workforce, people who are out in different departments. So for example, one hospital I worked with had a respiratory therapy department that was doing a Kaizen board. So they were going to put that board in their office, their team room down in the basement, but the team members were often not in that room. They were out in different units where they've been assigned, working with patients. And so they kind of built in some steps in their process, including asking people to carry cards with them. So again, when they saw a problem, when they had an idea, they could write it down and then put it up on the board when they were back down there in their team room. So, on the point of leadership buy-in, this is something I hear a lot of feedback about, a lot of really common challenges in different organizations where people feel like there's a catch-22. They don't want to start with Kaizen because they're afraid there's a lack of leadership buy-in. And that might very well be true. And it's probably ideal to get started with the type of really high-level senior support that Joe Schwartz has in his organization. And by the way, Joe's on the call today. And so when we get to Q&A, Joe had agreed that if there are questions for him or some things specifically about his organization, he'll help answer that. But I think a lot of times, sometimes organizations will use the lack of leadership buy-in as an excuse to not get started. Now again, this organization had gotten started, they had multiple boards, that's great. But I think sometimes the way to gain leadership buy-in is by demonstrating the results of the Kaizen process and letting them see the potential so that it's not theoretical, but it's very real and very meaningful in a lot of ways. So I'm going to share an example of that in a little bit that might really get executive attention. But back to the question about, guidelines about, well, what does done mean, for example? Even though this board in the 4 columns is generally pretty simple, sometimes people struggle a bit with saying, well, when does it move from a new idea to a to-do? It might be when a supervisor has at least acknowledged and read the card and had an initial discussion. The to-do column might mean, we're considering doing it in reality. An organization might decide to leave cards in the new idea column until we've decided to definitely do it, and then that's where we can sometimes use color coding or other things to indicate, which cards are brand new, which ones have been reviewed and are just waiting, and I'll show an example of what one of my clients came up with to help do that color coding. But back to the question of, well, what does done mean? We go from doing to done. I think the answer is it depends. If there's some simple, straightforward things that can move to done very quickly. So one organization I worked with, the nurses pointed out, we've got patients who are diabetic and in heart conditions, and we should probably have whole wheat bread available instead of just white bread. So that was pretty trivial, pretty uncontroversial. They called food services. They got it added. The next day, they started getting wheat bread delivered. Those can go quickly and say, okay, that's done. We're going to write a Kaizen report, do the before and after, and just kind of go ahead and share. There might not be as much study and adjust to be done on some of these simple Kaizens and the PDSA mindset. But then there's more complex Kaizens or ideas that might come up through this process that need to be evaluated over a period of time, such as making changes to a triage process. So we might move the card to done when we are initially implementing or testing that new changed process. But, oops, I have a defect in my slide. I didn't finish the thought. I'd move these to done, but leave them up there and maybe not do the Kaizen report until we've let the process go for maybe 30 or 60 or 90 days. Some of these Kaizens we're going to really want to look at more data, consider, did this really work? Do we want to move back or not? So there you go, Kaizen opportunity on my slides. I'd like to say I did that intentionally to prove no one's perfect, but whoops, no big deal. Okay, so back to the idea of color coding. I love it when clients come up with really clever things that they can do to improve upon the basic Kaizen process that I teach them. So one of the things people have done is to use color coding. So if we have things in that column, for example, hasn't been initially reviewed by a manager, you can get different colored push pins. Red might mean it's brand new, green might be it's been reviewed by the manager. But sometimes people will use little dot stickers to put on the card to indicate, for example, is it on hold? We might get a red dot. Or is it ready to move forward from the to-do column using a green dot? So that way when people have time during their day and they say, well, gosh, what do we want to work on? They can save some time and see the color coding and not have to spend as much time asking about, is this ready to work on? Is this done and ready to write up in terms of a Kaizen report or not? So I really like that very simple idea, and that's something I try to spread and share with others. Now there was another Kaizen that people did very early in this process related to the board. And so the way they wrote this up, they said, basically the problem is that when the card is tacked up on the board, to read the back of the card, you have to physically take it down. You have to undo the thumbtack, flip it, and read the card. And someone asked, well, why don't we print the back side of the cards upside down? And so imagine this or go and try this. When it's tacked up on the top of the front of the card, you can kind of bend it up from the bottom, especially if you're using paper instead of cardstock. You can at least peel up and see, is there anything on the back of the card or not? And I think that was a really good small tweak to the process that worked for them. A little bit less motion, easier to see if there's updates, faster Kaizen progress. Then there are some other comments from another site that had done a board. They said, it's an easy way to get people involved at all levels, but some of their challenges included scope creep. And so this is, I think, people, if you're not familiar with the term, scope creep would be somebody doing, starting a Kaizen that said, for example, let me just go back to the earlier example, we should have whole wheat bread available for our patients. So that one should be fairly simple, but not yet. Scope creep would be somebody turning that card into a complete overhaul of the menu and the dining options for our patients. Like we might want to close out that one simple Kaizen card and then start another Kaizen related to, let's say, working with dietary on having healthier food choices for our patients. But even then, back to the lesson from the workshop about Henry Ford and small problems, sometimes we really just want to break down a big problem into lots of smaller problems. And again, try to make sure that people aren't turning a little small Kaizen into a big, huge project. And again, there was this thought and this challenge about, well, how do we get senior leader commitment? So if we have scope creep, or if people are bringing up really huge problems, such as if I fill out a card that says, we need to improve patient satisfaction, that's a really big goal, but we haven't really defined a problem, or the problem might be too vague. It might be patient satisfaction is too low. We can break the problem down, find components of the problem to work on. So we might look at the different reasons patient satisfaction scores are low. Noise at night, call light response, and even those might need to be broken down into smaller contributors to that problem. But at the same time, we want to be careful that we're not sub-optimizing the process, that we're not fixing one part that causes harm or problems in other parts of the process. And that's the role of leaders, I think, to look and see if that sub-optimization is occurring, or if it does happen in the PDSA model, to study the system and then adjust and say, whoops, we sub-optimized, let's change how we're doing this. Some other thoughts on getting senior leaders engaged. Once you have a board in place, have them come see the board. Let them come and see firsthand and read the cards, read the completed Kaizens. More often than not, what I see is that they're impressed by the range of issues people are putting up there. They're impressed with the commitment and the enthusiasm, and if they didn't realize that passion and interest was there, it sometimes makes it really visible, where if executives might think, if they're off in their office and say, oh, I don't think people want to do Kaizen. Well, having them come and see the board and showing that people want to work on this, that can be very powerful. So it's important to keep in mind, I think, that the leaders are not there to give feedback or to be critical. It's like the senior leader, C-level or VP, might think they're being constructive, that they're just asking, well, what if you did it this way? But because of their formal power position in the organization, this can often be intimidating or downright upsetting, and they won't realize it. So a lot of times I really emphasize that their job is to go and thank people, and to be appreciative, to see and to learn, not to say, well, I would have solved it this other way. If somebody had an idea and it worked, celebrate that. Maybe give feedback privately to the manager and kind of maybe plant an idea that says, well, maybe we could also do this. But I think especially very early on in a Kaizen process, we have to be careful about that feedback not being misinterpreted. In a more mature Kaizen environment, maybe we can speak more openly and honestly about our problems and what we do about it. We want to thank people for their efforts, and not just thank people who saved money, but give broader recognition for quality and safety, and then help share Kaizens that can be applied in other places. So in our class, we talk a lot about little, small, simple Kaizens that improve safety, improve quality, improve the patient experience. A lot of these don't have a really hard ROI associated. And sometimes little small improvements do. And so this is from an organization, they're a customer of KaiNexus, which is a software company I work with. And in one of their specialty pharmacies, they found the before problem is that patients were going to outside specialty pharmacies. And then what they did was realize that, well, a lot of the patients just didn't know that they had an in-house pharmacy that they could use. It would be more convenient. It's right down the hall. There's better clinical integration. And so they added in, not to be pushy or not to force it, but just inviting patients to use the in-house hospital health system pharmacy. You can see in the effect is that converted in endocrinology about 1/3 of their patients to using the in-house pharmacy. That was $638,000 in those first 3 months, or $220,000 of additional revenue that had just been walking out the door every month. And then, well, this is really powerful. They didn't spend money. They just tweaked their process and communicated a little bit differently with patients. And this has a huge multi-million-dollar financial return every year. So I think, the way we get senior executives engaged, some of them may need to see hard numbers like this. Some of them may recognize the connection between letting people work on any little small thing, then eventually leading to something big like this. That's why it's so important to build enthusiasm and participation, and to not just focus on cost savings, or in this case, revenue increases, and to not just solely focus on ROI. There were some questions that came in, and again, if you've got questions that you want me to address, feel free anytime. If you want to type in the chat box, type your question, or just say, hey, I'd like to ask a question. We can make that happen. Somebody asked here, and I didn't get their email address to be able to follow up, unfortunately, but they said, how do you restart after a failed project? And so I didn't know if this really meant, quote unquote, a failed Kaizen. So let's say one simple improvement, one little small improvement that didn't work the way we expected. It caused other problems. It just didn't work out. It wasn't accepted. So I think we have to be careful, and again, I think as we mentioned during the workshop, really don't frame it as a failure. Think about, well, what didn't work? Why was that? What were the lessons learned? What else can be tried to solve the problem that was identified originally in the Kaizen? And go back and try something again in a sequential plan, do, study, adjust model. But if this question was really more about a quote-unquote failed Kaizen program, and I've seen over the last 7-8 years, some organizations get started with Kaizen, and 6 months later, unfortunately, it disappears and it goes away. And sometimes people are looking to kind of rejuvenate and restart their program. So again, I think we should understand why. Why did it fail? Why did people not participate? And what are the causes of that? We're not blaming the individuals, but we're asking and putting this burden on leaders, what could we do to better engage people, to get them participating? What can we do as opposed to pointing fingers and blaming the employees? What countermeasures can be put in place to make Kaizen work better a second time around? We probably want to be open and honest with people about saying, well, here's what didn't work, and here's why it didn't work, and here's what we're going to do differently. I think the same advice applies if we have a previous failed suggestion box program. Why didn't that work? What were the causes? We're not blaming you for not using the suggestion box, but here's what we're going to be doing differently, and why we think doing things differently will give us better results this next time around. So, there's always a lot of comments and questions about how do we make time for Kaizen? We've collected a lot of ideas. We're struggling to find time to make it happen. One example, and this is from one client I worked with, they had just completed their magnet certification. They had been meeting very regularly with that team that was working toward magnet, doing their unit council, and they were going to be, of course, continuing the unit-based council. But they decided they were going to rededicate, I think they had if they were 0.2 or 0.25 people from the unit working on unit-based council and magnet. They were going to now have them be Kaizen coordinators within the unit to continue working on this process now. They were going to use time and really make sure the unit-based council time was focused on, at least partly on doing actual improvement work, not just sitting and talking about it in the committee meeting. That's one thing. I think Magnet is great conceptually. I think it's a great program, but sometimes people complain, we have these unit-based councils and we don't really get anything done. People have a voice, but we're not making progress. And I think that's something, again, we need to figure out why is that, what can we do about it. And then we hear, so the challenges, again, of managers not having enough time for Kaizen. And I think one of the things I talk through with managers as we're doing this with the real board out in a unit is being careful and making sure that they, as the manager, that they're not taking on too much of the work themselves. We want to make sure that managers, where they can, are delegating and asking and challenging themselves, okay, I don't need to take this all onto my own personal to-do list or my own action item list. What can be delegated? What can I ask or invite people to work on? Well, we might say, but at the same time, don't leave the employee on their own. So we're not delegating and just dumping it on people. We're saying basically, go and give it a try. I believe in you. Go give it a shot. But I'm here to help if needed. I think it's a good practice. Managers sometimes need to go out of their own comfort zone to try delegating, even if they're not sure the person can do it. If you're not 100% sure. But again, we can tell them, hey, go and give it a try. This is going to help you grow and develop as an employee, but come to me if you need help. And if they come to you, kind of make sure and ask, well, do they really need help, or are they just afraid to try? Like, sometimes you need to push and say, well, go try that. Go give it a shot. But if you need to help them in the mode of a servant leader, then definitely jump in and do that. If your time is limited as a manager with staff, try to help prioritize the Kaizen work in different ways and make that prioritization clear to people or clear to yourself when you're choosing what to work on. I want to share a couple of thoughts about the role of managers, and as we talk about when we're doing this, coaching versus judging. We don't want to be judges. Somebody sometimes made the comment, our managers are picking apart ideas. That's viewed as negative, and it's demoralizing and leads to disengagement. A coaching behavior, it's positive, it gives constructive feedback. There was an interesting book I was reading earlier this year about small improvements, small ideas, and they talked about a practice from improv comedy. And trust me, I'm no comedian, but I appreciate a good improv comedy show. I know it's got to be incredibly challenging and really hard to do. And so when they teach improv comedy, they teach the actors to never say no, to never react to another actor's improv as if it's bad or if it's dumb, but to say basically yes, but. And kind of say, well, yes, but, and maybe you try to steer it in another direction. Now, part of me says, well, that sounds a little passive-aggressive. We don't want to say yes and then ignore, and that might be disrespectful. But at the same time, saying yes, but let's talk about that some more. You're acknowledging that there's probably something good in the person's idea instead of rejecting it altogether. And kind of along those lines, we might also say, a judge might say, be quick to say, here's why we can't do something. Where I think as a coach says things more along the lines of, how do we make this work? Or here's how we can make it work to help move the process along, to coach and to help, rather than just accepting or rejecting ideas. That's one thing I really don't like about the old suggestion box model. Managers are coaches, or they're judges. They say thumbs up, thumbs down. They never collaborate, they never go and discuss. It's just yay or nay. That doesn't work very well. I think another question that comes up, and it's a very practical thing, is the question about, well, how much planning do we do in the plan, do, study, adjust cycle? Where's the balance between planning well and being responsible versus planning too much, or getting into what people might sometimes call analysis paralysis? We want to avoid, as one client of mine talked about, we can't just have endless discussion about an idea. And sometimes people feel comfortable with the endless discussion because it's safe. We just keep talking about it. We don't have to take a risk to actually go try to implement something. But I think the amount of time we spend on plan depends on things like, how risky an idea is. How easily could the change be undone? So if it's really risky or really high cost or really hard to undo, like I've been in hospitals where someone, and we ended up doing it, knocking out a wall in a nurse's station. That's fairly risky, it's fairly expensive. We couldn't, if we knocked down the wall and realized a week later that was really dumb, there was no way we're going to be able to go to facilities and get a new wall put back up, right? So we have to be really careful in some cases where there's other changes, we just go and do it and see what happens in that PDSA mindset. So we go do a little bit of plan, then jump into do, and then study and adjust. For other types of changes, we'll do a lot of plan, and then some do, and then study and adjust. And I think as leaders, we need to learn the balance between when do we, go get input from everybody, and then do it. It's like knocking down a wall. We might want to get input from lots of different people on lots of different shifts, and then go and do it. Then there's other types of changes where we're basically going to just do it, and then inform everybody. Here's the change that we made, and then get input after the fact. We've made this change. Here's the new process. Let us know how it's working, and let us know if you have any additional ideas. So again, that simple example of adding whole wheat bread to a unit, we could have spent 2 weeks going and trying to talk to everybody, but it was one of those kind of, well, let's just do it. Like, who's going to be upset from having whole wheat bread added? But now part of the PDSA cycle was that we needed to look and get input and say, well, if the balance was out of whack, where patients really did want white bread even when whole wheat was available, then we might need to tweak and adjust the inventory levels accordingly. Or we might change the process if the nurses and dietitians really kind of want to encourage whole wheat bread. We can make some changes to that process. So if we were always running out of white bread but still had wheat bread, we would study and adjust probably rather than just completely getting rid of the whole wheat bread altogether. I want to share a couple ideas of what I see people doing to help share and spread good practices through the organization. How do you compare notes and how do you share different ideas over time? So when we talk about the Kaizen approach itself and say, well, what's working well, what isn't working well, and what do you do about it? So you might say, well, what works well is having a daily huddle at the start of shift. Or something that wasn't working well was the way we were asking for ideas, like I talked about earlier, when I wasn't really engaging people. So that's okay. We learn from that. What can we do about it? We can share those examples with others. When we talk about the Kaizen process, and I see people doing this, especially if it's multiple sites within a health system, they do a monthly conference call. I'm doing one of those tomorrow with a client in Minneapolis, where they'll have people dialing in from 4 different hospitals talking about the Kaizen process. What are they learning? What are they doing? How are they adjusting? They'd like to do, and I love this idea, of having an internal Kaizen conference, possibly once a year, of people coming and bringing and presenting and sharing both the Kaizen methods, but also talking about specific Kaizen improvements that can be shared and spread across different hospital units. So for example, if there's a cardiac unit at this one hospital that added whole wheat bread and added ginger ale because patients were nauseous and they didn't have ginger ale, they could spread that idea with the other 9 or 10 hospitals in the system through some different forums that they might set up. And then one other thing to talk about before we go into some Q&A is some feedback about what people are doing in terms of technology. So the one organization brought up and said that, we like the visual approach, we're only using the visual board. So I think it'll be interesting to see how that evolves if they go from one board to multiple boards. How do you share? How do you give visibility? Because people usually do end up trying to apply different technologies in their bigger efforts. As we talk about in the book, Joe Schwartz and Franciscan, they built an internal database. One of the other people who responded to the survey said they use a Microsoft Word table with the Kaizen report format, and those are saved on the network drive for sharing and collaboration. I've seen others kind of do a similar approach. They do the Kaizen reports in a PowerPoint format. They save those all in a shared drive, and then they maintain some sort of spreadsheet that shows a list of all of their different Kaizens. So that's easy to set up. It tends to have some limitations when we're trying to rely on spreadsheets or email to manage process. But there's one technology one of the people from the workshop was using, and I've heard this one brought up a number of times. It's called Trello. And it's a web-based system. And as you see, and this is just a screenshot from their website, the four columns are ideas, to do, doing, and done. Very, very similar in the software world, and that's where a lot of people are using systems like this. They would refer to this not as Kaizen, but they call this a Kanban process, a Kanban model for improvement, where you've got different ideas and you sort of move them along when people have time to work on them, in what we would call a pull system in the lean world. So that's one type of technology that's out there. And we do have one of the participants from the workshop who is using Kinexus, and this is a company that I work with. I want to make that conflict of interest really clear and transparent. I do work with this company. This is another web-based system that either in conjunction with an idea board or in replacement of an idea board, it creates visibility and allows people to communicate and share and collaborate even if they're not in the same physical location. So, bulletin boards are great when everyone's standing right there, but sometimes these different technologies help us collaborate and help us spread and share ideas throughout the organization. And one other thing that these systems can do, and this is a screenshot from Kinexus, is to do charts and metrics and reports and things like that that can be very helpful over time. So those are some of the things that came up in the survey. I want to jump ahead just to a couple final thoughts, and then we'll see if there's any questions from the live attendees. One thing, just as a quick mention, and then I have something to offer you for free. One thing that I do, and in some cases Joe and I will do this together, we do have an on-site program called a Kaizen Kickoff, where instead of just being in the classroom and just doing a simulation, we build upon that and actually go and start a Kaizen pilot program out in a department. So as I've been describing a little bit here today, coaching with managers, working with staff, actually getting a live board up and running, getting it started or kicked off, and then following up and coaching and supporting them over time. So if this is something you're interested in, please feel free to reach out. But then one thing I want to offer just as a complete free giveaway, as a thank you for attending today. Some of you might know that I have a blog site called leanblog.org, and I also do a number of podcasts. Joe Schwartz and I have done a podcast talking about Kaizen at Franciscan. These are recordings that you can get through iTunes. You can play on your iPhone or whatever device. But I've taken transcripts from a number of these podcasts, and I've put them together into an ebook that you can read as a PDF or put it on your Kindle. If you use the link here at the bottom of this slide, and I'll send the slides out with the recording. If you go to this address, it'll allow you to do a free download of this book. So I want to give that to you as a thank you for participating today and for sharing feedback. So with that, we can do some Q&A. Here's my contact information. I'll leave this up on screen. I'm going to switch over to the control panel. Let's see if I can do this right. So again, we've got Joe on the line to answer your questions. I can answer your questions. If you've got any questions here, go ahead and type them in the chat box, or just type, hey, I want to ask a question, and I'll unmute you. And if we don't have any live questions, that is of course fine, and we'll end early. I'll leave a few minutes in case someone's typing and waiting for that to show up before I bail out. But again, I'll share a couple thoughts to wrap up as maybe you're thinking of a question or typing one in. The reason we like doing these workshops, and Joe and I are doing one together in Detroit next week, it's that we want people to actually go take these ideas and put them into practice. And I'm happy to hear a lot of the workshop attendees are doing that. In keeping with the Kaizen spirit, those of you who came to the workshop last April, that's the worst workshop I'll ever do, because I got good feedback on it, but I'm always trying to improve the way these workshops are done each and every time. Joe and I are working on that to make sure we're focused on things that are really practical, really actionable, not repeating things that are in the book, chapter 1 that people are reading in advance. So I'm trying to demonstrate and practice Kaizen through our way of teaching Kaizen. But, all right, well, it looks like there aren't any questions coming in. But again, if you've got follow-up questions, please reach out to mark@leanblog.org. If you've got a question for Joe, just say it's a question for Joe. I'll forward it along and get you in touch with him. But thank you for your time today, whether you're attending live or whether you're in the recorded session. And I want to wish you great success.